I have a small question, Ambassador, that I personally feel that food should be a part of healthcare. And we talk about the food the least. Uh, it's more about the taste than healthcare. Uh, like, for example, milk were an integral part of Indian healthcare system, and we were all healthy, I think, in a way. So how can food be a preventive part of health, and how can we change the dynamics, the paradigm?
Uh, Thank you very much, Subhriji. It's indeed such a great pleasure for me to be participating in the session, even though it's only virtually. I wish I'd been able to come there in person and interact with all of you and meet up with a lot of my friends who are there today. But I look forward to doing that in the near future. Now, also, before I talk about food being an essential part of well being and wellness and physical health and mental health, what I'd like to say that it has been such a great pleasure for me to listen to some of the distinguished panelists and speakers, including General Sharma, who spoke from his heart, my dear friend Amitabh Kant, whom I've known for a very long time, who agreed to write the preface and to participate in this event today. Minister Hardeep Singh Puri, who's been my mentor and guide and friend since the day I joined the service, and whom I have a lot of respect for. And of course, Professor Ruvi Pavankar, whom I look forward to meeting someday, Professor Madhav Das Nalapat, who's one of the most distinguished people we have in India in terms of thought leadership. So, and amongst many of the others also there. But what I would like to say about food is that, you know, food is definitely a very important part of the framework and construct of every individual being. Now, we have been told by our ancestors, by our parents, by the gurus, that sattvic living, sattvic food for a sattvic life. There are different types of food: sattvic food, rajasic food, and mansic food. And I do not want to get into the details of that because I do not want to offend my friends who go beyond the vegetarian, diet. But sattvic food basically consists of the plant-based diet. And a friend of ours, we live in Washington, D.C. currently. She recently wrote a very eminent book, which is called Healthy Food for Happy Living, for a Happy Life. Now, she talks about Ayurvedic cooking, Ayurvedic food, how the Ayurvedic path, Ayurveda has shown the paths to healthy living in terms of having a healthy physical existence, having a healthy mental existence, and being able to surmount diseases and challenges to mental and physical health. So the world has to also sort of start appreciating this a little more and come back to the basic grassroots. The pandemic has, of course, impacted our lives in very profound ways. I was impacted very personally because some of our closest friends, were sacrificed to the pandemic. And that got us thinking as to how we can work together. And I thank my dear friend, Dr. Joseph Chalil, for working together with me on the first book, which actually became an Amazon bestseller in two categories: healthcare and public policy. And also became one of the 20 best reads in the world on the pandemic recently. And also this second book which has come out on this area, this is my eighth book in person, but the second book on the pandemic, which has also become a Amazon bestseller in three categories during the pre-launch period itself, with over 1 lakh tweets, and it has a long way to go. Now, what this has taught us is that therapeutic care is also required, but what is much more required is basic well-being and wellness. And how do we focus on that? Through meditation, through yoga, through diet, through exercise. So, diet becomes a very important part of daily living. I personally am a vegetarian. I've been a vegetarian all my life, since my birth, actually, and that has stood me in very good stead. Even at my age, with the amount of you know, kriya and yoga that I do not feel one bit my age. I feel a lot younger, and I feel I can continue to contribute a lot more significantly to society, to community, and to the world. Now, from that perspective, to have a little more emphasis on the diet, I think you have made a very good point, Supreet. We should have given it a little more prominence in the book, and we will keep that in mind in the future, because we do look forward to having a lot more discussions about the pandemic, about the book, about the contents, about the future, and about having more interactions about the contents of the book also when I'm next in India with various groups. So the other part which I would like to mention here, Supreet, is that it has been an inflection point in many ways at different levels. When I look at it from a perspective here, sitting in Washington, D.C., and looking at the world, looking at India, looking at the other countries, what do I see? That this was a transformational journey for India also, internally and globally. It has emerged on the global stage as a real Vishwa Guru, as a guru in the truest sense of the term. Because in the West, what I saw was a very transactional approach, a very commercial attitude and outlook. Even for selling vaccines to other countries, they wanted their price. Even the way they were bargaining with India initially, before India embarked on its own path to discover a new way of doing things for the world and for itself. And the vaccine war, that way, is a very outstanding movie, and I would recommend it very highly. But I would also say that certain countries like China had a very dubious role to play in this entire scenario, whereas India emerged as a country which not only did a lot of good to its own citizens, but did a lot of good to the poor and uh, developing or least developed countries of the world by providing vaccines free to them, by looking after their healthcare needs. And we have been doing that in medicines and pharma, as you know very well, compared to all of us, because we have been in this field now for such a long time. So I do look forward to the scenario where India continues on this path and becomes the leading healthcare provider. India is the largest population, 1.4 billion people, number one country in the world, more population than the entire Western world put together, or the entire continent of Africa put together, or the Americas put together. And our rural population itself is about 900 million people, 897 million people. Now, that population again is more than the continents put together, whether it's Africa or Europe or Americas. So if you have to cater only for the rural population of India, which I want to emphasize is another very important segment which we are working very closely with in India, with the governments of Madhya Pradesh and Himachal Pradesh, and also with Gujarat. So those sort of initiatives are very, very essential in healthcare. How do we recast the ground level scene in terms of not getting into the transactional and commercial approach, like Professor Nala has also mentioned that one of the delivery systems which is very wanting is the system in America in terms of the costs and benefits associated with it. And how do we now leverage the advances in technology in Industry 5.0, Industry 4.0, and make it more human centric and for the benefit of everybody by using AR, VR, MR, the different sorts of realities, machine learning, data analytics, cloud, quantum computing. How do we leverage those advances in technology to make healthcare, well-being, wellness, and thereafter treatment accessible to all at a very low cost, which is affordable for all? Thank you. Back to you, Supreet.
Thank you so much,
If,
sir, for your
if,
insights.
if I can,
You've kind of summed up a lot of things with the vegetarian diet. Even I'm struggling right now. I try, but still a battle I'm trying to win. Ambassador Kapur, one opening statement.
Well, my opening statement would be that this is an inflection point in the transformational journey for the world to understand the relevance of India on the global stage in the Global Committee of Nations. And the time has come for India to be welcomed into the UN Security Council as a country, which is strategically very important for the world, which is very important for the world in terms of having the largest population and one of the youngest populations, as a country which is a driver of the global economy today, more than any other country in the world, as a country which is contributing in so many ways to digitization. And I am associated with some fintech work also, and I see the impact of Indian fintech on the global stage. So, from all these perspectives, the time has come for the world to become a little more accepting. Today in India, we have hardly any headquarters of any global organizations. For the first 77 odd decades of our existence after independence, not a single global headquarters was established in India for any global agency. The first headquarters which was established in India was the International Solar Alliance, which was partly due to India, mainly due to India's efforts, not partly. The second headquarters, which has been established, the Global Biofuels Alliance, again driven by India's initiative. Yoga is accepted as the International Day of Yoga all over the world. The world is very grudging in its respect for India and its appreciation for India and its understanding of India. The time has now come for a change in that attitude and for understanding what India brings to the world, so that not only the world benefits from it, but also the Indians can contribute even more to the world. I see Indians as leaders. The Vice President of US, she is of Indian origin. The Prime Minister of UK is of Indian origin. The Prime Minister of Ireland, Portugal, the Prime Ministers or Presidents of so many countries in the Caribbean. So we have great leadership potential. That is apparent. Nobody denies that. The CEOs of some of the biggest American multinationals are of Indian origin. In the C-suite of US corporations, more than 300 of the Fortune 500 have some top Indian in the top 3 or 4 executives of every organization. The Silicon Valley, more than 30% of the startups in the Silicon Valley are from Indians, IIT engineers and others. I can go on and on. The unicorns in the world, the maximum unicorns in the world are being created by Indians. So there is no limit to the potential of India. There is no limit to what India can contribute to the world. It is now for the world to realize that and open up the doors and their hearts and their minds to this reality. Thank you, Supreet, for asking that question.
Pleasure. Great answer, sir.